understand that you guys are heavily focused on innovation and moving the ball forward and thinking out of the box, and I'm hopeful that my conversation with you will give you some perspectives on my lens on the world and the lens that McKesson has given our time on the planet. I thought it'd be helpful if I spent a few minutes framing who McKesson is, so you have a perspective on our business and sort of our perspectives around healthcare and healthcare changes and reform. I'll talk a little bit about the world of healthcare globally, and then spend a few minutes talking about our agenda for better health. Clearly, it's a complex time in this world. I turned on the TV set this morning to find out that American Airlines had filed for bankruptcy. Every day there's more Occupy Wall Street crowds wandering around the planet, and there's all kinds of challenges associated with tax and spend policies globally, and we clearly have our share of challenges here in Canada from a healthcare perspective. McKesson's been around since 1833, so we're on our 178th year. So in addition to being a large and I think well-respected company, we've gone through lots of transitions in our history, and clearly our history is filled with sort of the ebbs and flows of government policy and economics and the needs of people around the world. We've been in Canada since the early 1900s, and we acquired a company called Medis here. Our perspective in Mckesson Canada is very similar to what it is in the U.S. Our two major lines of business are pharmaceutical wholesaling, which remains our largest business, and our technology businesses. And the convergence of using the right meds at the right time and making sure that the patients stay on those meds, the adherence to the world of pharmaceutical utilization is extremely important in healthcare reform and the healthcare debate. But clearly the use of technology to reinvent healthcare, automate healthcare, and reduce the variability in healthcare is extremely important as well. So the convergence of those two streams of work has really been underway at McKesson in the last decade in particular, and I'll spend some more time talking about how we view our world. But I'd say the biggest framework we have is around better health, and it really starts with the health of the patient, but it works backwards into the enterprise, and it's really better health on three dimensions: the business health of our customers, the clinical performance of our customers, the clinical performance on behalf of the patients that they treat, and then connectivity, which is an emerging theme that really is beginning to provide not only significant challenges for providers in the country, and in North America for that matter, but around the world, and also opportunity, I think, to improve the state of healthcare. Last night, Dr. Williams talked a lot about culture and how important culture is in any organization that's trying to go through change. And he clearly, if you were here, spent a lot of time talking about the culture of NASA and how the lead and follow kind of attitude of the great professionals that have risked their lives on behalf of our world to invent a future for us that we've all been enjoying is extremely important. At McKesson, we set a culture in place that we call our I Care shared principles, starting with integrity, doing what's right, customer first, listening to our customers carefully and working backwards from our customers from a needs perspective to build out our portfolio of capabilities, accountability, doing what we say we're going to do, and when we can't accomplish something for whatever reason, having the courage to admit failure and recommitting to a workout plan that solves the challenges for our customers. Respect, we try to provide not only the outward world the respect that the world deserves, but internally inside of our company, the respect that we need to give our associates to accomplish our tasks, and excellence, being the very best that we can be in all areas of the businesses in which we compete. We probably have 50 or 60 different lines of businesses, and we hold our people accountable for performance in those lines of business. But the most important opportunity for us is when those lines of businesses converge and create opportunities that otherwise may not exist if we weren't one company focused on a single task of making our customers perform better from a healthcare perspective. Now, clearly, if you look around the globe, the state of healthcare is a challenge for every one of the economies, whether it's the meltdown that we see in Southern Europe and the crisis that we see in Italy and in Greece and perhaps Spain and Portugal and other countries. The issue of healthcare and healthcare entitlement is a driving force that's putting pressure on these societies and on these governments. As I mentioned, we see three key challenges that haven't been fully addressed and we think haven't been fully optimized. And hopefully places like this where people are thinking broadly and have an opportunity to reflect on the opportunities and the challenges, we can come up with new innovative solutions that will solve some of these problems. And clearly, Canada is facing the same challenge that the rest of the world is facing. $192 billion in expense. Now I believe close to 11.7% of the GDP is spent on healthcare, but still half the rate of the GDP, about half the rate of the GDP that the US spends on healthcare. A significant competitive advantage, but also one that puts a tremendous tension on the system when your spending doesn't rise to meet the demands perhaps of your society. We know there's inadequate hospital funding in these markets, and I think 38 or 40% of the hospitals in Canada are over budget this year, and that clearly is in place also in Ontario. In Canada, you face the same challenges that we do in the US, an aging population. There are now more people over 65 in Canada than there are under the age of 15. The young are not growing up fast enough to pay for all of us that are aging. In the US, we have an additional phenomenon, and that is that as people age, they go into Medicare, and Medicare is where the taxpayers take responsibility for the funding of health care, whereas up until 65, it's largely the employers that are taking responsibility for health care. Every day, 10,000 new Americans enter the Medicare rolls, and so not only do we have the aging demographic issue to deal with, we have the compounding effect of McKesson no longer paying for that employee's health care and the government having to pay for that individual's health care. And across North America, 77% of men and 85% of women that are over 65 have at least one chronic disease. And as was discussed yesterday in some of the sessions, this issue of chronic illness was not how our systems were set up. We were set up largely to take care of acute issues and send people back to the farms. And today we're taking care of people that wouldn't have lived as long as they've lived. And clearly with the advancement of medicine, they're going to live a lot longer than our system was built to handle, both structurally but also economically. And as people continue to age, this issue of chronic illness in the treatment of chronic illness and the prevention or the delay of chronic illness is going to be a key issue for all of us to deal with. And like everywhere else in North America and across the globe, Canada is facing its fair share of shortages from a provider perspective. We simply do not have enough physicians at the primary care level or enough pharmacists or nurses to do the job of counseling patients and taking care of patients the way that the patients are increasingly demanding that their care be given. And clearly, like the rest of the globe, we have connectivity challenges in Canada. Probably less than 40% of the people in Canada that are physicians are using electronic medical records. It's less than 10% of the folks are using order entry, automated order entry to place clinical orders, which is a great tool to help prevent errors at the very start of the care process. And something as simple as barcodes, which all of us experience every day in a retail setting, where you're at a grocery store checking out and your potato chips are being scanned to assure that the right price is being charged to the consumer. Something simple like barcodes on medications and on a patient and on a nurse provider or a physician. Those barcodes don't exist in Canada just like they don't exist in the United States. Less than 8% of the pills administered in Canada are administered using barcode technology to assure that it's the right patient, the right medication, the right dosage of the medication, and it's delivered at the right time and the right route. Those 5 routes aren't verified in a machine-driven way, and human error certainly exists. So we clearly believe that there's significant opportunity for us to affect change across the board on a myriad of these dimensions, and I'm going to give you a few examples where we believe the application of smart technology will allow us to make changes in the way healthcare is delivered and sustain those changes. At McKesson, over the last 178 years, we've been able to grow from a company that was relatively small in terms of our footprint to a global company that now has nearly $120 billion in revenues. And we've done that in particular through the use of technology to reduce the variability in our operations, and through programs like Six Sigma or Lean, where we've driven out variability in our operations and then automated those operations to prevent the slippage that inevitably occurs when you don't have the metrics to drive continued performance and measure that performance on an ongoing basis. So although a culture of change, a culture that's open to changing the way business is conducted is going to be important in every industry, and in particular in healthcare, I would argue that it's nearly impossible for the culture alone to affect change the way that it's going to be necessary for us to significantly advance the ball in terms of productivity and clinical care quality delivery without the use of technology or automation to make it happen, to prevent that slippage that inevitably happens. Now, to use a simple example, I'm a bit of a baseball fan, and if a person gets 2 extra hits a year, they're no longer a 250 hitter, which is relatively dismal. They become a 350 hitter, which puts them at the upper end of baseball players. Simply 2 extra hits a week. If a youth will exercise 16 more minutes a day, it'll prevent them from being obese. And that's only a small expansion of about 25% of the amount of exercise that they get normally. If they can just put that extra effort in, we can prevent obesity. And I would argue that there are simple things that we can do in the healthcare systems, particularly in North America, that will make a big difference. And rather than trying to boil the ocean in terms of the challenges we all face, if we find a few simple things that we can focus on, not only the cultural aspects of it, but the technology aspects of it, we can make a big difference and have an impact almost immediately. So I'm going to give you a few examples where we're doing this work. A lot of these examples are Canadian examples. Some of them haven't been brought to Canada yet, but we believe are applicable and will have some benefit. And as I mentioned, we'll get into some Q&A. Just like everywhere else in the world, Canada faces significant bottlenecks from a throughput perspective. And those of you that are consumers in the healthcare system here or have friends who are consumers in the healthcare system, you know how difficult it is to make it through the process here in a timely and efficient way. Activity typically peaks midweek and midday. Beds are usually not available until later in the day. The emergency rooms get backed up sometimes for 12 or 14 hours. There's a constant search for availability, a constant search sometimes even for the patient. We know the bed is occupied, but yet the patient isn't in the bed or in the room, and they're somewhere else in the facility being treated. And there's tension between the departments in terms of the logistics of moving these patients around and opening beds up. And clearly there's a tension between the patient, who increasingly is the consumer of healthcare, with consumer-like demands around, I guess my time is invaluable because I'm sitting in the waiting room for 14 hours while you guys figure out whether or not there's a bed or an emergency room available to treat me. Now, clearly a culture of empathy and focus on making a difference to these patients from a throughput perspective is going to be critical. But I would argue that most of the care providers in this room understand the tension and respect the fact that the patient has other things they'd rather be doing than waiting for a bed to be opened or to be discharged or to get into the emergency room. And half the time it's not a question of attitude or culture, it's just a question of visibility and understanding the throughput possibilities that might be available. We've been doing some work with Ivey, in fact, to look at ways to provide real-time patient information, to allow this information to be aggregated and analyzed on a real-time basis, to make it available on television monitors basically throughout the enterprise so that people have visibility to the patient activity, almost like an air traffic control system for healthcare and for patient flow. It allows us to align the departments and promote proactive behavior around managing patient flow within the enterprise. We've got an actual installation of this product in several of them in the United States. In fact, hundreds of them in the United States. But healthcare is different in Canada, and it's different around the globe. And we do have a great installation going on, and that's already been successful and up and running in the UK at Walsall Hospital. In that simple implementation over a 4-month period, we had a 21% reduction in the average length of stay, a 40% reduction in the emergency wait limit that they'd set on themselves for 4 hours, a 78% reduction in the number of surgeries that had been canceled due to a lack of available beds. So clearly a tremendous example of success, and we have similar kinds of trials underway in Canada where HAV is beginning to show the same kind of promise. This enterprise visibility system which is easy to implement and quick to get value out of, that takes the combined culture and sensitivity to patient throughput and uses a technology to allow that culture to make change. Another example of challenge that we all face is the inefficient process of med management. You know, clearly, in the United States alone, the issue associated with the use of pharmaceuticals, the appropriate use or adherence or compliance to the medication that has been prescribed by the physician is only at 50%. A significant lost opportunity clearly for the pharmaceutical industry, which we're a part of, but more important, a significant impact to patients who are not being properly treated and who inevitably end up in a more expensive care process than they otherwise would have if they had been just taking their meds. And obviously there are adverse consequences to medication errors and clearly sometimes fatal consequences to medication errors. So we've been heavily focused on automating the medication management process. I mentioned barcodes on the technology, but inventory management to take out the significant investment, pharmacy automation to reduce the labor both at the retail setting as well as at the hospital setting. We're really trying to focus on getting the patient and the pharmacist connected so the pharmacist can help assist in the care process as opposed to being totally consumed in the dispensing process. We've done some work recently with Niagara Health System. We had a big pharmacy program there that allowed us to reduce inventory by $602,000. We've significantly impacted the unit level inventory, the product that's up on the floors, by nearly $1 million, and significant savings across the board from a labor and workflow perspective, and in the end, a significant reduction in medication errors, which improved patient safety. Once again, an example where what seemingly is a simple process of administering the right drug to the right patient at the right time is made more complex because we've allowed ourselves to get stuck in a place where we haven't used technology to support the activity of these great professionals. We've done the same thing on retail pharmacy, where we've taken central fill technology, where a patient will go online at night and enter their prescription for a refill, and instead of having that refill consume the pharmacist at the retail counter for the first 4 or 5 hours when they come into their store in the morning to fill up all of the prescriptions that have been delivered to them electronically the night before, we can actually fill those scripts on a centralized basis in our wholesaling operations and deliver them to the store packaged and ready for delivery to the patient when the patient appears at the store to collect those prescriptions. And we've implemented that with great success in many markets. And I'd say that the last and perhaps most significant challenge we all face that is accelerating as our population ages is the issue associated with access to primary care. We are simply overwhelming the primary care physicians in North America, and in particular, our schools are not, in the U.S. As an example, are not graduating enough primary care physicians or people interested in performing primary care tasks, and they're becoming specialists. And so the combination of increasing demand and a reduction in supply of physicians that are properly trained to do this, and the idea that the physician is supposed to perform the role of a medical home, the coach, the advocate for the patient in a more holistic way, is putting increased demands on these professionals. And simply, without the leverage of technology and other healthcare professionals, we will never be successful in effectively helping patients manage their own chronic illnesses or their own acute problems. Here in Canada, we implemented a program called HealthLink 811. It's in Nova Scotia. It's a 24/7 telecare service line. We have it staffed by registered nurses. It's accessible anywhere in Nova Scotia, and it really has allowed people to have access to medical advice real time without having to wait to see their doctors or having to wait on the phone to see their doctors or talk to their doctors, but also, frankly, without having to queue up in the emergency rooms to have a problem treated. We had over 100,000 calls in the first year in this center. 61,000 people had symptoms that did require an immediate assessment and follow-up care instructions, helping people find their physicians and telling them how urgent the matter might be. But there also were 24,000 trips saved to the emergency room where the patient was already en route or had intended to leave for the emergency room and called this nurse triage line in advance of making that visit and decompressing the queues associated with emergency treatment in Nova Scotia. So, another example of tremendous success. In the end, I think the idea of convergence between technology and leadership and this culture of change is extremely important. All of you are in this room because you believe leadership is important, and you're all in this room because you believe expanding your thoughts and your view of what's possible is important, and you're all in this room because you believe innovation is possible and that innovation is going to be vital if we're going to change the way healthcare is delivered. I would ask you to consider how technology plays a role in innovation, and it's not just technology as it relates to the care intervention, where most of us, particularly physicians and nurses, think of technology perhaps in the application of healthcare to a patient. I would argue that part of the missing link in healthcare reform debate in North America is the use of technology from a business perspective. And whether you're government run or whether you're not for profit or whether you're for profit, from a healthcare perspective, the business of healthcare is as important a dimension as the clinical care part of healthcare. And our ability to focus on productivity improvements in both dimensions is vitally important if we're going to create a healthcare system that will be able to handle the burdens of our societies going forward. And the third big dimension and big opportunity for us is to use the world of the web and connectivity to better inform each other of the care processes that are underway for a patient, but as important, to connect that patient to the care process the way they want to be connected, and in a real-time, live way that's efficient and focused on having them take ownership for their own care. I know healthcare is a complex issue, and I know many people in this room would argue with me that we can't trust patients or consumers to make their own decisions around care. We can't trust that they'll make the right decision about going to the hospice as opposed to being in our intensive care units. We can't trust them to make the right decisions around medication. I would argue that if we don't begin to educate consumers around wellness and educate consumers around their own ownership of their own health care, we are going to miss a significant opportunity to leverage the power of the consumer to reform this important industry in a way that none of us can through the stroke of a pen. And we're also going to allow the consumer to force us to experiment with changes in our own operations on an ongoing basis that will provide us a view and a way to get a better performance and improved performance over a long period of time. The consumer has long been absent in the healthcare equation, particularly in markets where the economic burden has been borne either by government or by employers. And that absence of the consumer and perhaps intervention by governments and regulators in healthcare, I would argue have prevented the ongoing innovation that has attacked and reformed almost every other industry on the planet. And to the extent that we can attract consumers into caring about themselves, we will be much more successful. And you can be assured of the fact that McKesson will continue to focus on helping our partners be successful in the three dimensions of business health, clinical performance or clinical health, and connectivity on an ongoing basis. And I'm delighted to have the opportunity to be here today, and I want to thank Ivey and the leadership at Ivey for allowing McKesson to participate and be part of this important dialogue. And I'd be happy to address any questions you might have. Thank you.